Hello everybody, another video in our NPR channel for all the people who speak English with us. Today we will talk about the occlusal guides, the protection for the TMJ. Does your occlusion protect or destroy your temporomandibular joint? It is a question that every professional working in the mouth should ask. For many years, dentistry has focused almost exclusively on aligning teeth, closing spaces, and improving the aesthetic of the smile. Yet behind a perfectly aligned smile, there may be a temporomandibular joint in distress. The so-called anterior guidance, formed by the upper and lower incisors and canines, is much more than an aesthetic concept. It is a key functional structure that guides mandibular movements and protects the temporomandibular joint during function. When the anterior guidance is properly designed, it directs the mandible during protrusive and lateral movements. It decompresses the condyles, avoiding impact on the retrodiscal area. It allows smooth, stable, and interference-free motion, and it dramatically reduces the risk of bruxisms and muscular overload. But when that guidance does not exist or is poorly designed, the entire system falls into imbalance. When the mandible cannot find a physiological path to move, the body seeks compensations. The result is a chain of symptoms and dysfunctions. Bruxisms, as the muscles try to stabilize an unstable bite. Joint pain, as the condyles are compressed backward. Postural alterations, since the mandible is part of the tonic postural system. Tooth migration, fractures, or orthodontic relapses. And finally, rehabilitations that fail. All of this happens because the occlusion was designed for form, not for function. A beautiful but dysfunctional occlusion eventually destroys the temporomandibular joint. Nature is wise. When the mandible moves forward or sideways, the anterior guidance allows the posterior teeth to separate. That separation is not a mistake. It is a protective mechanism. It prevents excessive load on the posterior teeth and on the TMJ. If the anterior guidance is not properly constructed, posterior teeth collide during eccentric movements, and that microtrauma is transmitted directly to the joint. That is why a well-designed canine guidance protects the TMJs during lateral movements and a correct incisal guidance protects it during protrusion. When both are working, the entire craniomandibular system operates in harmony, and that harmony is not only felt in the mouth, it is reflected throughout the body posture. In myofunctional postural rehabilitation, the NPR method, we understand the mouth as part of a much larger system. The TMJ cannot be analyzed in isolation. It is directly connected with posture, with the cervical spine, with the facial and neck muscles, and even with foot support. That is why, in our method, the anterior guidance is one of the fundamental pillars of functional balance. We don't just work with this, we work with the entire body, seeking coherency between bite, posture, and neuromuscular function. A well-balanced anterior guidance is like an insurance policy for the TMJ. It keeps the joint safe and allows rehabilitation that lasts over time. So, I invite you to reflect. In the occlusion you are designing for your patient, protecting their joint or slowly destroying it. Aesthetics are important, yes, but function is even more important. A beautiful smile means nothing if they rest upon a damaged joint. The functional dentistry seeks balance between aesthetic, function, and posture. At NPR, this is precisely what we work on, restoring physiological balance to the craniomandibular system, protecting the TMJ, and improving not only the mouth, but the entire body of the patient. Remember, functional occlusion is not an aesthetic option. It is a physiological necessity. And understanding the anterior guidance is the first step toward transforming your clinical practice into true dentistry of balance and health. If you wish to explore this topic in depth, join our training programs in myofunctional postural rehabilitation. You will learn the diagnose and treat TMJ dysfunctions from an interdisciplinary and postural perspective. Visit our website and follow in our social and come into our web application to see our courses. See you in the next podcast in our socials.